So patients with eosinophilic esophagitis, with it being a new disease, are often more informed than their physician, and because they have read a large amount of data and information. And to help with the process of engagement with people who are not maybe perhaps as well versed, it's important to consider preparing for an office visit and identifying ways best to communicate with your physician, providing questions beforehand, and requesting what the best way is to communicate with your physician beforehand so he can be prepared, he or she can be prepared for the visit itself.
There is, I think, if anything, that is the most crucial thing. As I tell families that this is not an ear infection that is 10 days of antibiotics and you're done, or a strep throat. So this is a longer term issue. And secondly, my style, and I am sure many of my colleagues' style, is that we don't come in the room, pontificate and walk out in 20-30 minutes. We really have to engage. And then the third thing is, nobody knows the child better than the parent does. And I make it very clear and very obvious that they know their child better than I do, and I really need and value their input, because I can come in the room, tell them what to do and walk out, but they are the ones who are dealing with it. So keeping all of that in mind, so that is setting the stage to empower them, because often the patient may not be very comfortable being empowered independently without me encouraging it. Once it's encouraged and facilitated and promoted, I find that people are very engaged, and they just have to make sure that they understand what is being told. And often when it's a preteen or teenager, I speak to them and not to the family, in the sense the family is in the room, but I'm directing to them. So, and when they ask me a question, or and then I give positive feedback. I'm so glad you did it. You know, this is your health, your care. So I think there's a two-way street where initially, honestly, it has to come from the provider, that we make it an open process and a welcoming process and embrace them. And then at the same time, the patients then take ownership and feel comfortable. But it's terribly important that this be done.